Hello everyone, this is JP Singh. I welcome you all on my channel Medicos Marthi. Hope you all are happy and healthy. My dear friends, so today's session is short 19 subject session. This session is targeting upcoming exam FMG and NEET PC for year 2023. And in our today's session, we are going to discuss mixed bag questions from psychiatry, dermatology, ENT, orthopedics, forensic medicine, radiology, and one two subject more. Okay, so here we are going to discuss 6 to 7 subject questions, and there are around 27 to 28 questions. So let's start our today's session. Here we go. Question number: a patient died due to jaundice. What will be the color of corpse after embalming? Gray, green, yellow, brown. So my dear friends, here the correct answer will be green. Okay. Why the green is correct answer? Because in jaundice embalming, we are using here formaldehyde as primary preservative, and this formaldehyde initiate generally a chain reaction, yellow-green color reaction, and this formaldehyde based solution converts bilirubin in body to biliverdin. The main thing is conversion of bilirubin to biliverdin, which is leading to change in color to green. Embalming a body within 6 hours gives satisfactory result. So my dear friends, the correct answer here is option number B, that is green. The doctor who had treated the victim for gunshot injury was summoned with subpoena to testify in court with relevant medical documentation. What category of doctor does a subpoena fall under? So the correct answer here will be option number A, that is legal documentation. That this kind of subpoena fall under legal documentation. Types of summon it will include subpoena ducitectum and subpoena and testifactum. In legal document, it will complain the attendance of witness in court of law under penalty on particular date, time, place for purpose of giving evidence. And this fall under section 61 to 69 CRPC. Okay, let's go to question number 3. Pyrogallol test is used to diagnose. Pyrogallol test is used to diagnose. My dear friends, it is used to diagnose air embolism. Okay, it is used to diagnose air embolism where we differentiate whether air bubble in heart is due to decomposition or air embolism. Presence of brown color is due to air embolism. Here they have given one procedure. In one syringe, you will take 4 ml of 2% freshly prepared pyroglycol plus aspirate air bubble from heart. Stopper is fixed. Now shake it. The result will be brown in color, and this brown in color result is simplifying that this is due to air embolism, my dear friends. Question number 4. A doctor takes consent before surgical procedure, and also he may go beyond the consent if he feels the need for patient benefit. So this type of consent is defined as doctrine of extended consent. So the correct answer here will be option number A. Doctrine of consent, doctrine of extended consent says that when there are unanticipated findings during the procedure, doctor can extend the procedure in favor of patient. So my dear friends, let's go to next question. Liquid chemical is discarded in yellow, red, white or blue bag. Here the well and proper answer is option number A, that is yellow bag. In yellow bag, you can discard human, animal, anatomical waste, solid waste, expired waste, chemical, discarded linens, mattress, routine mask, chemical, liquid waste. Okay, and on the next page you can see all type of bags. Non-infected waste, that is cytotoxic and drug chemical waste, is discarded in black bag. Okay, and in infected waste, here you will use soiled waste, anatomical, infected plastic, sharp needles, cut glasses are generally put down in white bag. Syringe, gloves and plastic uh, waste, it is generally put down in blue plastic bag. And yellow will include placenta, pathological waste and body parts. Okay, and soiled waste, it will include dressings, pop cast, that will include in red plastic bag. Okay, so black, it is showed as secured land filling. red, deep burial. Okay, yellow is also can be deep buried. Blue, it is said as to be recycler, and white, it is said to be sarpit. So my dear friends, let's go to next question. Active disinfectant property of bleaching powder is mainly due to formation of hydrogen chloride, hydrochloric acid, hypochlorous acid, and chloramine. So the correct answer here will be option number C. Hypochlorous acid. The main action of disinfection is due to chlorine, is due to hypochlorous acid. 90% of disinfection. Hypochlorite ion contribute 10% to disinfection. Okay. 2.5 gram bleaching powder is required for disinfection of 1000 liter of water. Let's go to next. Which of these sampling method is probability sampling method? So the correct answer here will be option number C. That is lottery method. Lottery method, it is a probability sampling method. It is also known as random sampling method. Random means equal and known chances. Random sampling method can be done by following type. It will include simple, systematic, stratified, multi-stage, multiphasic, cluster random. Here the correct answer is lottery method. The result of a randomized trial was that the mortality rate in treatment group was 20% and the mortality rate in placebo group was 25%. Calculate NNT, normal number needed to treat. So here the correct answer will be option number C. It will be 20. Okay. How you calculate NNT? It can be calculated by 1 by ARR. ARR is absolute risk reduction, and it can be calculated by CER minus EER. CER, it is control event rate. EER, it is experiment event rate. So in this case, ARR equal means CER minus EER. It is 25% minus 20%. Here you will get ARR equal में 5%. So the NNT will be 20. So normal number needed to treat will be 20. Is there 20 available in option? Yes. So the correct answer will be option number C. So my dear friends, now let's go to next question. Here we go. Female with 41 weeks of gestation confirmed by radiological investigation very sure of her LMP. No uterine contraction, no effacement, no dilation. What should not be done? So my dear friends, here we have to avoid option number D, PGF2 alpha. We can give misoprostol, dinoprostone gel. Okay, we can give this. We can give intracervical folace. Okay, we can use this, and can be used or preferred during second trimester or abortion induction. Okay, PGF2 alpha carboprost causes sudden tonic contraction. Okay, but it will lead to sudden tonic contraction of uterus, and it is a drug used in prevention and management of PPH, postpartum hemorrhage, not for induction, but here we are using for induction. So option number D, it will not be done. PGF2 alpha is not used. An obstetrician instruct her resident to give PGF2 alpha injection after having tried oxytocin, methyl ergotamine, misoprostol for management of postpartum hemorrhage. After a few minutes of relief, the patient start to bleed again, and so doctor asked to repeat dose of PGF2 alpha. The maximum dose in PPH management which can be given over 24 hours is, थोड़ी देर पहले हमने क्या देखा था कि PGF2 alpha is used for case of postpartum hemorrhage. Now doctor have given here the dose. Now the examiner is asking in 24 hours what can be maximum dose. So the maximum dose can be, correct answer will be option number C, 2 mg. Okay, you can start from 250 musi IM up to 8 dose, and maximum dose can be given 2 mg. Okay, So the starting dose you will start, you will give it into 8 doses, but you can give maximally 2 mc. So the correct answer here will be option number C, not option number A. A patient with GCT, giant cell tumor, which of the following is false? You have to tell false statement regarding this image. So my dear friends, correct answer is chemotherapy. Okay. GCT occur in epiphyseal metaphyseal location. Okay, correct है. It is eccentric in location and can go till the joint. It is correct. Okay. And locally aggressive with defined margins. Okay. So option number A is correct, B is correct, C is correct, but not D is correct. And treatment of choice will be extended curatives with autograft. So here the correct answer will be option number D. Not true about somnambulism among the following is. So the correct answer here will be option number B. Patient consciousness is preserved. Sleepwalking or somnambulism is a disorder of arousal usually seen in children. Okay. In generally it occurs in deep non-rapid eye movement sleep. Okay, most often takes place in first third of night when these sleep stages are most common. Identify the disorder shown in image. So it is option number D, contact leukoderma. It is a case of contact leukoderma. It is never present at birth. Contact leukoderma generally occur due to cosmetics, most frequently on the face. The eyelids are particularly involved. Contact leukoderma due to hair dyes applies to patient, affect the hair margins rather than the scalp skin. So the correct answer here will be, according to this image, option number D. A patient presented with multiple painful blisters and erythematous base along dermatome on trunk as shown in image. Diagnosis. So here the correct answer will be option number B, herpes zoster. Herpes zoster, it is an infection that results in Varicella zoster virus, which will reactivate from its latent state posterior dorsal root ganglion. Symptoms usually with pain along affected dermatome following 2 to 3 days by vascular eruption, that is usually diagnostic. Treatment is antiviral drug, ideally given with 72 hours after skin lesion appears. So here the correct answer will be option number B. It can be treated by antiviral drug which can be given within 72 hours. 5-year-old unvaccinated came to OPD with fever and red eyes. On examination, the following type of rash is seen. What is most likely complication associated with this condition? So the most likely complication associated with this condition, it is acute myocarditis. Above case of child, it is suffering from measles. Okay, this child is suffering from measles, and most likely complication associated with this condition is acute myocarditis. Virus causing myocarditis are Coxsackie virus AB, Ecovirus HIV, and influenza virus. Less commonly, it can be seen with adeno, measles, HSV1, cytomegalovirus, rubella, and varicella zoster. So here the correct answer will be option number A. Identify the conditions shown in image. So here you can see in this image, and the shown condition is borderline leprosy. It is borderline leprosy case, my dear friends. So the correct choice will be option number B. Borderline leprosy, it is characterized by hypochromic plaque that are well defined and have apparent central sparing of the skin. And you can see here Swiss cheese appearance. Acid fast smears often are strongly positive. Okay, so borderline leprosy में क्या दिखेगा हमें? Hypochromic plaques, and it will be appeared, it will have appearance like Swiss cheese. It will include papule plaque macules nodules, and acid fast stains are here positive, my dear friend. The most likely diagnosis for the tumor at upper end of tibia. So examiner is asking here what the tumor it is. So my dear friends, it is case number A, that is GCT, giant cell tumor. Giant cell tumor, only the tumor to involve joint is 20 to 40. Okay, occur in epiphysis, extend to metaphysis, so called epiphyseal metaphyseal tumor. uh, Unicameral bone cyst, it is x-ray hair shown fallen leaf sign. अगर UBC होता तो क्या दिखता? fallen leaf sign. अगर ABC होता then x-ray will show you expansile lytic cytic lesion and MRI will show you fluid filled levels with lesion. If it is case of contrablastoma, then there will be presence of chicken wire calcification. So according to this image, the correct answer will be GCT, that is option number A. Which of these are subcortical dementia? Parkinson disease, Wilson disease, Huntington disease, Pick's disease. So my dear friends, here the correct answer will be option number A, that is Parkinson disease, Wilson disease and Huntington disease. Here you can see the classification of cortical dementia and subcortical dementia. So subcortical dementia में Parkinson है, Wilson है और Huntington है. ठीक है. So the correct answer here will be option number 1. In cortical dementia you can see Pick disease and other option are here not available. Pick's is excluded here because it is type of cortical dementia. Subcortical involve other left options. Disinfectant are chemical agent designed to inactivate or destroy microorganism on inert surface. Which of the following is not a halogenated disinfectant? So my dear friends, the examiner is asking here which is not a halogenated disinfectant. The correct answer here will be option number D, because Savalon, it is a kind of quaternary ammonium compound combination of cetavalon. Another given options are halogenated compound. Okay, so another option A, B, C are halogenated. Only the option number D is not halogenated. Multiple punched out lesion in skull is seen in acute leukemia, thalassemia, multiple myeloma, carcinoma of prostate. What do you think? The correct answer will be, according to me, it will be multiple myeloma. And it is absolutely correct answer, because ये क्वेश्चन इतनी बार पूछा जा चुका है, अब तक तो स्टूडेंट्स बिल्कुल इस चीज को लेकर श्योर हो चुके हैं कि इस क्वेश्चन का आंसर क्या होगा, मल्टीपल माइलोमा. यू कैन सी हियर बोथ इमेजेस. ओके, दोनों के अंदर मल्टीपल पस्ट आउट लेसन जो दिख रहे हैं वो क्या शो अप कर रहे हैं आपको? इट इज केस ऑफ मल्टीपल माइलोमा एंड दिस इमेज इज टेलिंग अस दैट इट इज रेन ड्रॉप स्कल. ओके, ये क्या है? एक रेन ड्रॉप स्कल है. ओके माय डियर फ्रेंड्स, रेन ड्रॉप स्कल क्यों बोला है? इन मल्टीपल लेसन्स की वजह से. A 64-year-old male brought to casualty with history of fall. The patient is in severe pain. There is tenderness on the great trochanter and also the patient is not able to walk. The lateral border of foot touches the bed. What is most common complication in given clinical scenario? So here the correct answer will be malunion. Okay, the correct answer will be option number C. This case is representing the fracture of neck of femur that is intertrochanteric, and extracapsular or intertrochanteric fracture is more common than intracapsular. Okay, so extracapsular fracture या बोलो कि intertrochanteric fracture क्या होता है? More common. Most common complication of extracapsular fracture of neck of femur is malunion. इसकी मोस्ट कॉमन कॉम्प्लिकेशन क्या है एक्स्ट्रा कैप्सुलर फ्रैक्चर की? वो है मालयूनियन. क्या ये ऑप्शन में है? जी बिल्कुल. मोस्ट कॉमन कॉम्प्लिकेशन ऑफ इंट्रा कैप्सुलर फ्रैक्चर ऑफ नेक ऑफ फीमर इज एवेस्कुलर नेक्रोसिस. क्या एवेस्कुलर नेक्रोसिस कहीं ऑप्शन में है? नहीं है. सो यहाँ पर जो करेक्ट चॉइस थी वो क्या थी? एक्स्ट्रा कैप्सुलर फ्रैक्चर, और उसकी मोस्ट कॉमन कॉम्प्लिकेशन क्या है? मालयूनियन. सो द करेक्ट आंसर हियर विल बी ऑप्शन नंबर सी. Identify the angle shown in image. So this angle shown in image, it is Cope's angle. It is Cope's angle, and this condition of spine is scoliosis. This condition of spine is scoliosis, and this angle is Cope's angle. And here you can see the Cope angle in this picture. Okay, 0 to 10 spinal curve, okay, 10 to 20 degree mild scoliosis, 20 to 40 degree moderate scoliosis, and 40 above 40 degree it is severe scoliosis. So here you can see spinal curve is rotating to mild scoliosis. Here it is going to be mm, moderate scoliosis. It can also become severe scoliosis. So the correct answer for this question will be option. A 30-old year male present with swelling over knee joint, biopsy revealed mononuclear and giant cell. What is diagnosis? So here the diagnosis will be option number B, that is osteoclastoma. It is a case of giant cell tumor, my dear friends, and the age group involved in giant cell tumor generally it is 20 to 40 years. But here you can see in case of giant cell tumor the predominance is toward female, but in this case the male is affected. The age group is 20 to 40. Most common location is distal femur, okay, followed by proximal tibia. In GCT there have egg cell cracking on palpation. Tumors are benign. Pulmonary metastasis occur in approximately 3% of patients, my dear friends. Classical route of spread of retinoblastoma. So my dear friends, the classical route will be optic nerve. Okay, generally optic nerve plays a great role in spread of retinoblastoma. Retinoblastoma, it is kind of mostly encountered primary intraocular malignancy. It occurs, it can be seen in third 3% of childhood cancers, and it is second most prevalent intraocular malignant tumor after uveal melanoma. Optic nerve invasion can occur with the spread of tumor in subarachnoid space into brain, metastatic spread, the regional lymph node, liver, lungs, bones, and brain. So, my dear friends, the correct answer will be here option number B, that is optic nerve. A patient present with redness and pain in the eye following trauma with vegetative matter. On examination, there is a corneal ulcer with hypophyme. This ulcer is dry looking feathery margin. What can be diagnosis? So the diagnosis can be option number B, fungal corneal ulcer. So the correct answer here, according to given history in is this question, the correct answer is option number B. Fungal keratitis commonly result from fungal access into corneal stroma through a defect in corneal epithelium, as given in question history, trauma of vegetative matter, all which are leading to permission to fungal invasion. In general features you can see as given history, you can see pain, you can see redness, you can see discharge and bleopharospasm, you can see blurring of vision. With corneal infiltration, patient have a sign of inflammation of anterior chamber with hypophyne. So सब कुछ एग्जाम में क्वेश्चनर ने दे रखा है. According to this question case, the correct answer will be option number B. Which of the drug are used to differentiate fixed dilated pupil? 4% cocaine, pilocarpine, adrenaline. So, my dear friends, the correct answer here will be option number B, that is pilocarpine. 1% pilocarpine it is used, it will constrict in third nerve palsy. And condition associated with fixed dilated pupil include third nerve palsy, uncal herniation, angle closure glaucoma, AD pupil, pharmacological block. Okay, it will also help 0.25% of this pilocarpine will also help in differentiating AD pupil. So AD pupil, it is also condition associated with fixed dilated pupil. So the correct answer here will be option number B, that is pilocarpine. Most common eye manifestation in Sturge-Weber syndrome. So the most common eye manifestation it can be glaucoma. Okay, glaucoma it can be seen in mostly 30% of cases and many a times 60% of cases. With Sturge-Weber syndrome, we can see most common eye manifestation, that is glaucoma. It is also said as encephalotrigeminal angiomatosis. It is a congenital sporadic phagomatosis. So my dear friends, the correct answer will be option number B. Identify the face deformity shown in the pic. So the face deformity shown in the image are, what do you think, my dear friends? What is this shown? What is this, my dear friends? The correct answer here will be option number D, adenoid facies. Adenoid facies. Okay, patient mouth is open, overcrowding of anterior teeth, nose is pinched, elongated face, high arc palate. These are typical feature of adenoid facies. Adenoid facies, it is caused by chronic nasal obstruction and mouth breathing. The child has elongated face with dull expression, open mouth, prominent crowded upper teeth, and hissed upper lip. Nose gives pinched in appearance due to disuse atrophy of फेलाइनासी. सो इसमें कॉमन क्या चीज है याद रखने वाली? डिसयूज एट्रोपी ऑफ फेलाइनेसी. एंड ये जो कुछ फीचर्स हैं एडिनोइड फेसिस की, वो हार्ड पैलेट इन दिस केस इज हाईली आर्ट as molding action of the tongue on palate is lost. The given X-ray is for frontal sinus. Okay, what view is this? So frontal sinus के लिए पूछा है, and this view is Cadwell's view, and the most appropriate for frontal sinus. Okay, Cadwell's view क्या है? Occipito-frontal view and nose forehead position. Okay, nose forehead position, you can see this, and this is best view for frontal sinus, that is Cadwell's view. So my dear friends, so here you can see Waters view, Race view. Race view, it is a best for posterior ethmoidal cell, and Pyre view and Water view with open mouth best for sphenoid sinus. So my dear friends, this is all about our today's session. Thanks to everyone. If you feel that this session is helpful, then don't forget to share this session, like this session, and do subscribe to my channel for future updates. So my dear friends, stay safe, stay healthy.